Hello, and welcome to Read Scholars Live. I'm your host, Dr. Mary Fleming, and current president of Read Scholars. Today, I'm happy to have with me a friend and colleague, Dr. Olan Soremekun, who is an emergency medicine physician and the CEO of Cayaba Care. Hi, how are you today?
Wow. Thanks so much for having me.
So I am excited. So just for our listeners to know, I get to wear kind of two hats today. So we're, of course, here on the Read Scholars podcast, but we're going to spend some time talking about Kayaba Care, which is also near and dear to my heart. So we'll get to that in a little bit. So Olan, start us off kind of give us a little bit of background about yourself and why you decided to do emergency medicine.
Yeah, no, it seems like so long ago, but
When you were young lad.
yeah, but no, I really was drawn to emergency medicine for a couple of reasons. One, it was the one place where I sort of felt that as a healthcare provider, you never knew what was going to walk through the door in terms of acuity. And illness, but you also never knew who you were going to be taking care of, and you got to meet people at different levels in society. You got to meet people with different challenges, but ultimately, when anyone is sick in the emergency department, they're the same. And so, for me, was really just sort of energized by that, and energized by solving and helping people at probably their most desperate times. The second reason I like emergency medicine was just like the team approach, where you needed every member of the team working together to be able to solve big challenges. And that part of it for me was just really enjoyable and something that really drew me to the specialty.
And so, kind of how our paths crossed, we were both in the Philadelphia area. You were practicing clinically, and I was practicing clinically. And we'd had a few conversations about the limitations, I guess, of clinical medicine. So we enjoy that intensity of inpatient care and trying to make everybody have the best health outcomes they can on a one-on-one level. But we had a few conversations about trying to affect change on a bigger level. So your first kind of venture outside of clinical medicine was in the, as we say, working for a payer, right? So tell us a little bit about what that means and when we say that, and why you decided to go that route, or add that into your clinical repertoire. It's not like you went away from clinical medicine, but you added that to it.
Yeah, no, the when you spend a lot of time in big health systems or hospitals, you sort of recognize, and you and I used to talk about some of the challenges and the gaps that exist, because I think we were both well positioned to see it, right? I think OBGYN has a lot of similarities into emergency medicine, as it relates to, trying to really impact outcomes at critical times. And for me, I sort of recognize that, in working in clinical operations and work in practice, and we were reacting to some of the population health payer dynamics that currently existed in the system. And the more I asked questions, the more I wanted to understand, what is the other side thinking and why are we doing the things that we do? And the more people talked about population health, payer, and value-based models, the more I wanted to be involved in understanding that. So took a break from sort of academic practice and joined a payer and worked on value-based programs in the Medicare Advantage space. And that was great for me, but I always knew I wanted to come back to the clinical delivery side.
And so, we talk a lot about the business of healthcare and how it has evolved, even over the past, half a century or so. It's a very different dynamic than even when we were going through training and residency, and how the business of medicine has changed. And in the political landscape, we talk a lot about healthcare and how things are paid for and reimbursed and how that affects access to care. And so, we mentioned that at the beginning about who you take care of in an emergency situation, just like, OBs as well. We have to take care of whoever walks in the door. They present with an emergency situation. We have to take care of them regardless of circumstances or finance. But I think to your point, it's also frustrating because we're taking care of people sometimes at a very vulnerable state, and we have to send them home to a less than optimal environment, right? And trying to figure out how to deal with that. And that's not really an emergency situation, right? That's not something we can deal with in our clinical interaction, but definitely something that, we hope to build to kind of fill into that gap. So it kind of bridges us over to the transition to Kayaba Care. So tell people, how you made or how you became interested in the maternal health space, in addition to emergency medicine.
Yeah. Yeah. So for me, I always knew that there were gaps in the system, and I saw it in the emergency department. And around the time that I was thinking of going back to the delivery side, I knew I wanted to work on problems that address needs of certain populations. Didn't really know what population that I wanted to actually work on, but I knew I wanted to do it in a way that was different. And around the time that I was thinking of transitioning from my payer role, my wife and I got pregnant for the first time. And there's certain times that you're reminded that you're Black. And there's certain times that you're reminded that even though you spent your career training and working in big hospital systems and being a payer executive, things level off really quickly. And for me and my wife, it was the first time that we consumed healthcare on a regular basis. And our privilege got us really crappy care, right? And really got us sort of thinking about it. And I've never felt so powerless over not just a couple of day period, but over weeks.
Right.
When you're truly trying to figure out, how do I make sure that my wife and my future baby have the best outcomes? And you go through that process where you feel like you're not being heard. You go through that process where you have to advocate for yourself and for your wife and for your future son. And at the end of the day, thankfully our son is fine, but my wife might count as a statistic, right? In that it was a forceps traumatic delivery. She required and dropped her hematocrit. For those that are non-clinical, that's her blood count. Was in the hospital for a couple of days, and my son spent a couple of days in the NICU, right? And when I think about everything and think about all the problems in healthcare, and there are lots of them, for me at that point in time, I said that we could do it better. We could engage in a different way, and we could help support women and families to be empowered to have a better outcome as it relates to maternity. So that's what led me to Cayaba Care, and that's what led us to begin our work. And more and more, we look at the stats, and we should be infuriated by what the stats are, right? Which, with all the advances we have in healthcare today, we've done worse as it relates to maternity. If you're Black or brown, mortality, morbidity, and impact is worse, and it should be a much better process, right? When you think about all of the things we've invested in over time, to invest in better outcomes for moms and families.
Definitely, and it's such a powerful story, and I think that makes it a little bit easier, if you will, for people to understand what the process is. I mean, we look at the numbers and we know our maternity mortality statistics are horrendous, right? We know that our outcomes don't improve with education or financial status. The Black and brown women, even with college educations and beyond, still do poorly and worse than white women with high school education. So, to your point, even with the social privilege that we obtain, it doesn't help because our healthcare system is broken and it's not built really to take care of the entire population. And so kind of thinking about that, and when you were thinking about Kayaba Care and making sure that people are heard, because I think that's a huge part for me, is the empowerment piece and making sure people have the understanding and the tools to advocate for themselves and the support from a company or organization like Kayaba Care to fill in the gaps where it's needed. So talk to people a little bit about the design of Kayaba Care and what specific gaps that we're trying to fill.
Yeah, so at Kayaba, we're really focused on reimagining how maternity care is delivered, and there are a couple of things that are really important for us. We believe that care should be accessible, care should be culturally competent. We believe that care should meet patients where they are among the complexities of life, right? And so if you sort of think about, what the traditional, maternity care system is, it's like 15 appointments in an academic center or an office that's not really in the community, might be in the community, but to access it is not accessible. It requires that you have a level of privilege around being able to take time off of work, being able to prioritize other things that you might need in terms of childcare, being able to get to the appointment and actually see the clinician. For us at Kayaba, we're focused on meeting patients where they are, and that what it means is, bringing care to the home in a way that flexibly meets and fits into the complex lives of patients, as well as how we address all the other social determinants of health and factors that ultimately triangulate to the patient getting a better outcome. We do this by actually using a maternity navigator, who is someone that is from the community or related to the community, that gets trained up to support women in the prenatal and postpartum period. And that maternity navigator, in addition to educating patients and empowering them on what questions to ask, how to advocate for themselves within the healthcare system, is able to bring in members of the team via telemedicine into the patient's home. And we personalize the care team based on what the patient needs, and really drive towards journeying with the woman, the family, through the maternity and into the postpartum period. So that's our model, and truly, if I had to sum it up in 2 words, it's about community and it's about access, and those are sort of 2 things that are really important to us at Kayaba.
And, I love the fact that we were very purposeful about hiring from the community so that, one, it's a 2-part empowerment model, right? So we're empowering the women that work for us, the people that work for us. I shouldn't exclude the rest of the staff, but the people who work for us, as well as, trying to empower the patients that we serve. And so I think that is a unique and just awesome dynamic that we're trying to use. People may wonder, how are we different from other organizations that go to the home, or how are we different than traditional prenatal care? So can you highlight a couple differences on how we are unique in this space?
Yeah, so we focus a lot on bringing the care into the home, which has not been the traditional prenatal care model. So that's key. The second thing, in terms of other provider groups that are innovative and thinking about sort of home-based and the role of telemedicine, is, we focus on designing our solution for low-income women and families, be it on Medicaid or commercially insured. And while the needs of the patient are the same in terms of, quality, empowerment, education, feeling heard, there's certain needs that are unique to low-income populations, like transportation, childcare, income stability. And so we're designing with that in mind. And that is a true differentiator, when we sort of look at, what do we design for, what's our North Star, and what we're trying to build. That is a key differentiator compared to other innovative healthcare delivery organizations.
And so, and just to underscore, we talk a lot in certain conversations, we'll say, when we're talking about at-risk populations and having challenges to get to the appointment. And just to kind of set up the scenario, if you have 1 or 2 kids at home, to your point, you might be a shift worker, so your day-to-day schedule was not the same every week. You may not have your personal transportation, so you rely on public transportation. Those are the challenges that make trying to get to regularly scheduled appointments difficult. And so when you miss an appointment, some offices may say, well, this person misses the appointments all the time. She must not care. She must not want to be involved in her care. She must not care about her pregnancy. And those are not the cases, right? As we have lots of competing interests, and we have to figure out how to balance all those competing interests. And so having something like Kayaba Care that can help facilitate transportation or child care, or can fill in the gaps and come to your house, when on hours that traditional OB offices aren't open, can bridge those gaps to make sure that you're getting the most optimal care. And switching gears just a touch, and thinking about creating innovative solutions. So, lots of people think about things to do, and there have been, lots of research or community task force or public health interventions on a public health level. But it's a different thing to innovate in this space, in the startup space. So tell people a little bit about that process. What made you want to create something from scratch to bridge this gap, and how did that process go, or how is it going, I should say?
Yeah, no, it's when you want to bring innovative solutions in, right? Like you have to build it, right? And you have to build a solution that meets the needs and the gaps. And we talked about it, the numbers and the stats are worse than we were 10 years ago, right? And so we had to build something outside of the traditional system, not discounting the value of what the traditional system brings, right? And so I recognize that hospitals have great technology, great innovation, and the impact to truly do amazing work. But the hospitals miss on community and access. So we knew we had to build it, right? And so having said that, right, the question that you'll ask yourself when you're starting out is, do you build this within a big health system? You build this within a payer, or do you go out and actually do a startup and build on your own? The startup land, you have a lot of flexibility in terms of like the urgency and the speed by which you need to move to like solve a problem. Having spent time in big health systems, that's not the same. But it is really important that when you sort of think about the startup journey, before you actually go down that path, to think about what partners and stakeholders you have to engage, and to make sure that they are all aligned. And the partners and stakeholders in healthcare are many, right? So, it's the health system, it's the investors, it is the insurance companies, but ultimately it is like listening to the patient as well and figuring out what they want and what they need. And so starting that journey and saying we want to go through a startup involved a lot of research with all those key stakeholders and conversations, which you were a part of. And then once you get through that point and you align all the key partners that you need, then the exciting work of building begins, right? And truly learning, listening, testing, and getting smarter and moving really quickly to solve problems. And so I'm glad we took the path that we took. And I'm hoping that that speed translates to better outcomes for patients sooner, right? And so that's what we're really excited about.
That's the hope.
Yeah.
That is the hope. And just for people listening, to make sure that we were clear, and I think we said this, but just to be clear, Kayaba Care is not replacing traditional OB care. So women who participate in our programs will still have a primary OB provider. We are an additional support mechanism. So just want to make sure that everybody is aware of that. And so our goal, again, as we keep saying, is to meet each person where they are so that they're having the most optimal experience that we can help provide. So in closing, we've learned a lot, and I will say, just to kind of finish the comment that you were just saying, I've learned so much from Olan and with Olan over these past few months. So I'm very grateful that we were able to work on this together. And I'm very excited about our future and the things that we're going to be able to do in the future. But tell me, as we close, what I'm going to give you three options: either what you're looking forward to or hopeful for in the future, kind of what is kind of maybe next steps for you, or just because we've talked a little bit about innovation, do you have any words of wisdom for those who are looking to enter the space and be more creative in their solutions? So one of those, whatever you want to answer.
Yeah, so I'll start like hopeful for the future. I'm really hopeful because I believe that the 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 generations behind us are not acceptable of some of the injustices like that actually exist, and be it on environmental, be it on health, be it on economic, and those injustices that have existed over time and is no longer acceptable, and everyone is thinking about how do I solve big problems, and so that for me is exciting. I am super hopeful that as we look at closing gaps in disparities, that we're going to make big, bold moves and hold people accountable. That for me is hopeful, and fits really well in terms of how we solve problems that will be impactful to communities and patients, and so really hopeful and optimistic around that.
I like it. I think you kind of answered all of my questions, all wrapped up in one. So thank you. But thank you so much for taking the time out of your busy schedule. I know you are doing a lot. So we really appreciate you taking the time to share your journey to Cayaba Care with us and the importance of maternal health. And hopefully we'll be back here in a little while to get an update on Cayaba Care as we get further along in the process.
Excellent. Thank you so much for the time and opportunity.
Bye-bye. Thank you for listening to Read Scholars Live. Please follow us on Facebook, Twitter, or Instagram, or subscribe to our YouTube channel.